primary promise: building the nation's model health system for children. Doesn't every child deserve the chance to live a healthy life? A child's surroundings have a powerful impact on their health and potential, and effects can be lifelong. That's why we must reach beyond our hospital walls to help build communities that keep children healthy, happy, and safe. We're excited to introduce our Healthy Kids program. Helping children live the healthiest lives possible starts in our homes and communities.
We are really trying to think about ways to unleash the potential of every child in our community. 30% of our risk is actually around the conditions that we live and work and grow in. And so if you live in conditions where you may not have enough food today, or I don't know how I'm going to get enough money to make rent this week, that gives an undercurrent of stress that leads you into more illness, into more trouble, into more mental health problems.
Your support will allow us to create something remarkable, a model health system focused on lifting an entire generation of kids, keeping them healthy, safe, and out of the hospital in the first place.
So what we're doing is screening at every visit to ask them what risk they have. Then we're reaching out and connecting them to resources in our community.
Through Adverse Childhood Experience Screening, or ACEs, we can identify children who have experienced trauma and adversity in their surroundings and connect them with treatments to dramatically reduce their risk of future illness.
As a children's hospital, we've been in this business for over 30 years of trying to find ways that we can keep kids in our community safe. So we have our first program was car seat safety. We also have bike helmets, water safety. Another program that we have is our Reach Out and Read program. We work with pediatricians in their offices, and we supply books for them to give to a child every well child visit from the time that child is 6 months of age until they turn 5 years of age.
It's not just about the book, but it's about the nurturing relationship that you are empowering in a family. There was a really nice study that looked at kids who were exposed chronically to significant violence in their home. And those kids had nearly a 2 to 3 times more of a likelihood to have asthma. It showed that those same kids, if they were in a home where they received consistent nurturing, daily being read to, or interactive play, that increased risk for asthma was brought statistically to the baseline. Being able to empower that child and that family with the tools to promote resilience and strength for a child is a critical piece of Healthy Kids.
Healthy Kids includes a wide range of prevention initiatives, and we know a nurturing relationship is so important for healthy development of infants and young children. Our home visiting program, based on the nationally recognized nurse-family partnership model, matches at-risk first-time moms with a visiting nurse, providing support during her pregnancy and the first 2 years of her baby's life.
My name's Tarina Chapman. I'm a registered nurse.
Hi, I'm Shanique Jones. I have a son. His name is Javion.
I work with a program called Nurse Family Partnership, where we do home visits to first-time parents and support them in raising their children in home. So one of the things I really love about my job and really appreciate is watching how successful parents can be.
For me, as a parent, the hardest thing was just having him premature. Now it's just like seeing where my son progresses from like day to day and like how he is growing. I feel like it's a positive relationship to have Trina because she just gives you all the like perfect help and information that you need.
For years, we have worked to prevent injury from cars, bikes, ATVs, and drownings, to name just a few. And this work needs to continue. We also know that children can be harmed physically and emotionally by ongoing stressors or adverse events in their environment. We have developed programs to both screen and help families get the resources they need. It is essential that these programs are enhanced and spread to create a brighter, healthier future for our children.
Philanthropy has really enabled us to start these programs that at some point were just ideas that we wanted to do.
Each of us has an opportunity to give more children a chance to live a healthy life. And the truth is, our kids can't wait. Philanthropy will make an immediate impact that will last a lifetime.
Victor Hugo talks about in his book, he says, I think the quote is something like this: God had done a grander thing with it, he sheltered a child. And I love that concept that we can do so many big buildings and so many awesome things that look so big and grand, but touching the life of a child in a significant way is bigger. It has this piece of eternity mixed into it.